How is womb cancer treated? The most common treatment for womb cancer is the surgical removal of the womb. If you have a hysterectomy, you will not be able to get pregnant. Sometimes surgery and irradiation are used together. If you still want to have children, you may be able to use a type of therapy. Treatment can help to relieve symptoms and prolong your life if your cancer is advanced. What are the symptoms of uterine cancer? There are many conditions that can have the same symptoms of uterine cancer. There are symptoms of cancer. There is pain in the lower abdominal area. If you are postmenopausal, you can have a vaginal discharge that is clear. Vaginal bleeding can happen if you are older than 40. Living with womb cancer, women with womb cancer are usually the ones who have a hysterectomy. Recovery can take a long time. Lifting things and doing heavy housework will be avoided during this time. You won't be able to drive for a while after the operation. Some treatments for cancer can make you tired. You may need to take a break from your normal activities. If you need help, please ask your family and friends. The recovery time depends on a number of factors. What type of uterine cancer surgery will I need? Surgery is the primary treatment for endometrial cancer. The surgeon will most likely remove your uterus and cervix. If your cancer has spread to your uterus, you may need a radical hysterectomy. The lateral salpingo oophorectomies remove your fallopian tubes. If the cancer has spread, the lymph nodes should be removed. Most people need this step to make sure cancer is removed. Hormone therapy, artificial progesterone, is used to treat womb cancers. It can help control the symptoms of the disease. There are possible side effects of the treatment. Your doctor will discuss with you if this is a treatment for your cancer. Radiotherapy. The spread of womb cancer may be slowed by the use of radiotherapy. There are two types of treatment for womb cancer. External and internal radiation treatment are the same. The internal treatment is done with a plastic tube, while the external treatment is done with a machine. The course of radiation can last up to 4 weeks depending on the stage of the cancer. There are some side effects of treatment. Hair loss can occur in the area that is being treated. Menstrual and reproductive history. You are more likely to get cancer if you start your period before 12. Estradiol is in your uterus for a long time. The risk increases if the woman is older. People who haven't been pregnant have a higher risk of being pregnant. At what age is endometrial cancer most common? The most common cancer affecting a person's reproductive system is uterus cancer. There are two types of cancer that are included in uterus cancer. There is bleeding after menopause. If healthcare providers catch it early, surgery can cure it. What's the survival rate for people with uterine cancer? The 5-year survival rate for endometrial cancer is very high. The number of people who are alive 5 years after being diagnosed is 81%. The rate is higher when cancer is not spread outside your uterus. The survival rate goes up as high as 95%. It can be fatal if uterine cancer is not diagnosed. Signs and symptoms of cancer of the uterus. The most common symptom of uterus cancer is vaginal bleeding. This may include a change in your periods that are heavier than usual. A vaginal discharge is not as common as it might seem. In rare cases, symptoms include abdominal pain, unexplained weight loss, difficulty urinating, or a change in bowel habit. Radiation therapy. Internal radiation therapy uses radioactive substance sealed in needles, seeds, wires, or catheters that are placed directly into or near the cancer. External radiation therapy uses a machine outside the body to deliver radiation to the area of the body with cancer. External and internal radiation therapy can be used to treat cancer and may also be used to relieve symptoms and improve quality of life. Diagnose endometrial cancer. The results of a Pap test can show endometrial cancer. A sample of tissue must be removed and examined for cancer cells. Endometrial biopsy, hysteroscopy, dilatation, and curettage are some of the procedures that can be done. The tissue samples are checked for signs of disease by a pathologist under a microscope, and the tissue is then removed and examined again under a microscope for any signs of disease. What are the symptoms and signs of uterine cancer? Some people with cancer do not have any symptoms. A medical condition that is not cancer may be the cause of a sign. Abnormal vaginal bleeding can be a symptom of the menopause. The pelvic area is affected by abnormal Pap test results. Menorrhagia is an abnormal bleeding before the start of menopause. Abnormal vaginal bleeding is the most common symptom of endometrial cancer. Thank you for watching. Do subscribe, like, and share.